Hi, I'm Dr. Jay Harness from Breast Cancer Answers. You know, whenever patients meet with me and they know they're going to have surgery by me, they're really concerned about the cosmetic appearance of their breast. So the question comes up, gee, Dr. Harness, what ways are there to improve the cosmetic outcome from my breast surgery? Well, before I answer that question, I'd first like to take this opportunity to thank our sponsor, Breast Cancer Index. It's a test that may help women with estrogen receptor positive early stage breast cancer to decide with their doctor whether to extend or end anti-hormonal therapy after 5 years. Cosmetic outcome. For me, it's extremely important. And over these past few years at Breast Cancer Answers, I have constantly emphasized the issue of the oncoplastic approach to breast cancer surgery. Onco, meaning cancer, plastic surgery. It's a term coined well over a decade ago in Europe, which means that we're not only emphasizing doing the right and the correct extent of cancer surgery, but that we also want our patients to look good at the same time. So my first bit of advice for anyone facing breast cancer surgery is to make sure that you're working with a breast surgeon who has an oncoplastic philosophy and an oncoplastic approach to breast cancer surgery. Whether that's a lumpectomy with reshaping the breast, a lumpectomy combined with a lift reduction, a skin-sparing mastectomy, a nipple-sparing mastectomy. We want you, and you should be working with surgeons who want you to look good at the same time as doing the adequate cancer surgery for you. One of the difficulties that most patients face in this day and age is that there are multiple choices now in the treatment of breast cancer, including our surgical approaches. We've also seen a meaningful increase in the number of women choosing mastectomy, particularly with a dramatic increase in the number of nipple-sparing mastectomies being performed here in the United States and around the world. If you're having a skin-sparing mastectomy, then, meaning we're not saving the nipple areolar area, then there are some really neat things that can be done as far as reconstruction of the nipple areolar area itself. One of the coolest things that I've seen recently is called 3D tattooing. The results of that can be spectacular. There are actually artificial nipple areolar areas that can be attached that you can purchase, and we've had videos about that at Breast Cancer Answers. And of course, the standard way of recreating the nipple areolar area by the plastic surgeons is to tattoo on a new areola, turn up some skin to make it look like a nipple. If there was ever a favorite operation, and I use that term loosely, in my world of breast cancer surgery, it is the large D cup, double D cup, or today even a G cup size woman who has always wanted to be smaller. And at the same time of doing the lumpectomy, you can do lift reductions, make things perkier, smaller. It's a win-win situation all the way. So the bottom line of this discussion is, if you're facing breast cancer surgery, make sure that you're working with a breast surgeon who has an oncoplastic approach to your surgery, and that the surgeon also knows what the variety of options are to really enhance and improve cosmetic outcome. I hope that you have found this overview helpful. And as I close out, I'd like to take this opportunity to thank our sponsor, Breast Cancer Index. To find out more about treatment options beyond year 5, just click the button and download our free list of 15 questions to go through with your doctor.